My name's Greg. I'm a respiratory therapist, and I'm here to talk about motivational interviewing. Motivational interviewing is a technique that we use to help people quit smoking. It's a technique that is helping people through behavior change. It's more effective than just giving straight up advice. We know that if we give advice, although our intentions are good, very few people respond to advice giving. And with motivational interviewing, if you're doing it properly, you're not doing the talking. The person that you're trying to help does most of the talking. It's sort of a dance where you're facilitating and trying to pose really good open-ended questions to get them talking about behavior change. The first thing we do when we meet someone is try and establish trust. How do you establish trust? The quickest way to establish trust and rapport is by asking them to tell you about a typical day and how smoking fits into it. We talk about importance, confidence, and readiness. Once they're at a 7 out of 10 or higher on both of those importance and confidence questions, then they're ready. Then we set a quit date. We ask them to set a quit date about 3 weeks out, and we start building confidence, more confidence in that period, and it's practice time. So they practice skipping some cigarettes during the day. We ask them to eliminate the what the hell cigarettes, and each time they light one, they're asked to think about what is the trigger for this one. Once you've identified those triggers, ask yourself, what will I do to prevent this trigger from causing a relapse after my quit date? Because that's the key. They're also stretching the time to their first cigarette in the morning. So you smoke within 30 minutes of getting up. Let's try and stretch that to 40 minutes and play with that, and that builds confidence leading up to their quit date. There's a linear relationship between how much counseling a person has and what the success rate or quit rates will be at 6 months, and that's where we measure success. If I have someone who scores themselves really low on the importance scale, and I know that I'm not going to have a lot of time with them, I will use what's called a brief intervention, which is a scaled down version of motivational interviewing, and that has evidence to show that a brief intervention even will significantly improve the chances that someone will attempt to make the change. What's a brief intervention? A brief intervention is first off asking the person if they smoke, yes or no. The second question is, are you interested in quitting smoking, yes or no? If the answer is no, then I give them a statement such as a healthcare professional, I need to advise you, like I do all of my patients, that quitting smoking is the most important thing you can do for your health. And help is available if you want to have it. We have the Quit Now program in BC, or you can speak to me about it, or you can speak to your doctor. If I ask them if they're interested in quitting and they say yes, I say that's great, congratulations, I'm really happy to hear that you're doing that. I want you to know that that there is support and help available in this Quit Now program. Are you interested in having a brochure? Here's my card, would you like to come back and see me? So you're asking them if they're interested in quitting, or if they smoke, if they're interested in quitting, and then letting them know that there's help available. If you want to take that one step further, you can ask open-ended questions. Can you tell me a little bit about your smoking? Where are you at with that? Do you have concerns about it? What things don't you like about smoking? Ask a couple open-ended questions there, and they'll start talking about change, and you've done your job.